Hi class, in my scenario, I will be focusing on prescribing an antipsychotic to geriatric patients. In this scenario, I will have to access the patient knowledge regarding their medical history. Some ways that I can of seeing we go about doing that is seeing if they have a poor history and do they receive help with their daily activities. If they do, we provide that care. I have been noticing a lot of my patient settings in a different patient populations I have working with the geriatric specifically. Sometimes they have a child maybe that is with them at the hospital. More frequently, I notice that it is the spouse. Then in some circumstances, the family had a caregiver that provides all the care. All of those things really play a big role in how the patient's treatment plan who I will discuss is with to get a consent and make sure that they have a good understanding. With geriatric population, I really like to know only verbalize what type of education I'm providing, but also provide them in writing. I have found this is to be really effective, and as a provider, which I personally would like to do add to my own practice when I am a provider, is asking the patient, how do you like to learn best? Do you like writing forms? Do you like video? Do you like hangouts? Do you want me to verbalize, go over with you? Because kind of us as individuals know how we learn best. And asking that question not only personalized experience for the patient and shows that you care, but it also provides the practitioner a better idea of how the patient is going to be understand the education that you're giving. Um, I cannot compare the elderly population with that of a minor, depending on all those situations that I can of just state which play a role into factoring, and I will lead me to in the direction of how I want to proceed with the patient treatment plans and treatment options. According to a study done by the National Institutes of Health called antipsychotic treatment for elderly geriatric patients are an increased risk of adverse drugs reaction because of age-related pharmacodynamics and pharmacokinetics. So pharmacodynamics means that what effect does the drug have on the person, and pharmacokinetics means how is this drug procedure within the body. Other adults are often prescribed multiple medication for various health reasons that might be mental health, and then also they have cardiac issues or respiratory issues, whatever it may be. Given the fact that this specific population has an increased chance of having multiple comorbidities, the risk for drug on drug interaction is much higher than of just a general adult population or pediatric population. Common side effects in this patient population when discussing particularly antipsychotic agents will include orthostatic hypotension. This is a sudden drop in the patient blood pressure and sedation. These two things specifically I want to point out first because the risk with an elderly is them falling and injuring themselves. Just like in any other setting with elderly patients, there is no different. There are a bit of risk of falling and then breaking the hip, hitting the head, or having bleed. So it's really important when prescribing new medication to go and really, like I said earlier, I have thorough history of what other medications that are on, how often are they taking them, are they adhering to what's recommended by the provider. All of the information will be really playing a role in how you are going to proceed with your own treatment plan on our patients. Um, Other side effects that might see that are common with this specific type of class of medication will be anticholinergic effects, which slow the impulse between the nerves. So I just kind of think of I like slowing everything down. You might have a dry mouth, blurred vision, constipation, drowsiness, memory problems, urinary problems. Seeing that normally wouldn't give you an issue can give you an issue because it's slow, sinks down. Extrapyramidal symptoms can happen such as tremor and rigidity in the muscles and then also tardive dyskinesia, which is lip smacking and can be seen in some patients, as well as facial gestures that are involuntary being done. Given all the side effects that come along with antipsychotics, at this time it is what's best for the patient. You have to look at the risk versus the benefits. Unlike other antipsychotics, Abilify does not completely block a chemical in our brain, which is called dopamine. Dopamine is a neurotransmitter that helps us feel pleasure, so it is no kind of a happy chemical in our brain. It really helps give boost to the patients. So when dopamine is low in the brain, Abilify works by increasing those levels, and it does the same effect when dopamine is high. It helps lower them as well. It keeps a nice balance of dopamine in the brain, which can help balance out some of those maniac episodes the patient might be having or depression. There is various indication for the medication, which I will go over a little bit later. But it's really worth doing a well balance in the body. The more common side effects that patient may have seen with Abilify are restlessness and then the tardive dyskinesia. It is being shown to be really effective in acute treatment, and then also the well as maintenance medication. They don't have to stop it and switch to a different one. Another positive thing with this medication is doesn't have a known symptom of weight gain, which some of the other antipsychotics do have weight gain and sedation. The weight gain wouldn't be beneficial for this patient population because they're already at a high risk, or they possibly already have diabetes, possibly already having a heart condition. So that would be something that this specific drug they probably wouldn't have to worry about. And the sedation, like we talking about earlier, sedation is a huge issue with our elderly. The given fact that this medication isn't going to make them drowsy and put them as increased risk for falling is just another plus. For dosing, I refer back to the stall prescribing guide. For the elderly, dose adjustments generally are not necessary, but elderly patients are able to tolerate lower doses of medication, just like in another medication that are prescribed to the elderly. Always this, with medications, on how you are going to dose it, you are going to start at a lower dose, you are going to see how effective that dose is working for them, and then increase it based on the need. If they're having side effect, if they are not having side effect, something like that. So schizophrenia or maniac patients may need to have an antipsychotic. So it is recommended, if this is the medication for taking the medicine, you will start it like a 10 to 15 milligrams a day, and then you can increase it be no more than 30 milligrams a day. You could take it for depression as well. It usually used combined when it's used for depression with maybe an SSRI, but it can be used for depression as well, Abilify. Initial dose to be is 2 to 5 milligrams a day, and it can be increased by 5 milligrams a day at intervals of no less than 1 week. Maximum dose will be like a 15 milligrams a day for depression. This medication also works for Tourette disorder. Patient can start it to at 2 milligrams per day dose. After 2 days, you can increase the 5 milligrams a day, and then after 5 additional days, you can increase it to the 10 milligrams a day. Continue to increase the 5 milligrams a day interval no less than 1 week for maximum of 20 milligrams a day. It also is given to for agitation, like 9.75 milligrams with max dose of 30 milligrams a day. Even so, it is available for intramuscular use. I wouldn't give this as intramuscular if they have an indication that a medication needs to be given right away. This probably wouldn't be the choice that I personally choose. This would be a medication that would be indicated for oral use in my opinion. The other benefit with Abilify is there is not too many tests that you need to be monitored or labs that need to be monitored. A lot of our patients who are schizophrenic and bipolar have a hard time with medication adherence. This is something you could add to the list that this medication doesn't require, like other medications may labs that we have to check every week or to check every 2 weeks. Some common labs that the practitioner will want to check possible with the geriatric population would be every 90 days getting a metabolic panel, specifically for patients that may have increased blood cells in the past and or infection. A lipid panel to check for triglycerides, especially because they might have already have a high BMI and you just have want to monitor that. And then you will want to check the patient's weight and the blood pressure and the heart rate as well. The good thing is a lot of geriatric patients are already seeing their family care doctors every 3 months for maintenance due to the other underlying health issues, and a lot of these labs are already being drawn. So the patient, you can let them know if you already have seen the doctor every 90 days because of your diabetes or because you have a cardiac issues. You can actually, if you don't mind, you have them draw this lab for you, or you bringing me a copy of the lab, so that way you don't have to get two duplicate blood drops, and it make it easy for the patient. I think that Abilify is a really good antipsychotic for a psychiatric population. I have seen it more frequent to prescribe to geriatric patients because of the reduced amount of side effects. But again, I think that goes back to the re-educating the patient in the disease process, in the common things we see with certain disease process in patients not adhering to taking medication because maybe they started an inpatient and now they feel better, or maybe it is a financial reasons. But overall, I think that this is would be a good treatment recommendation. This is a good antipsychotic, Abilify, and it is a good first line treatment antipsychotic as well, that I will feel really comfortable prescribing. So at this time, thank you so much everyone in the class for listening, and have a great day.